Hello and welcome to another episode of News Connect on City TV. My name is Kojo Archman. Health professionals have come under serious criticisms following the death of a 70-year-old man who could not receive emergency health care from any of the 6 referral hospitals in the capital. Why? There were no beds at these facilities to admit him. Let's have a conversation with health professionals on what should have been done in such an instance.
We need to look at our referral systems carefully. I always say this. Most of the time, it's best that we develop the local facilities.
The ones close to us?
Yes, so that we reduce the need to transfer out. Let me pick one angle that I'm very happy with, which is the maternal health aspect. Now, if there are more locations where cesarean sections can be done, locally, as in if every district can do cesarean section, I think right away the load on Rage or Korle Bu will be reduced, or in that matter, Komfo will be reduced. Because if at the various 275 districts in the country, there's a center to at least handle cesarean section, then the need to transfer cases to the regional or general hospitals will be reduced. And that is why it's best we move healthcare to the doorstep, so that when it's a referral, it's not necessarily critically ill person, but sometimes you have to plan your referrals. And unfortunately, we don't do that here in the country. Most of the time, it's a last-minute thing. And that is where it's not helping.
So what goes into planning a referral?
Well, for instance, I might be attending to a patient for 9 months. And then towards the end, or even sometimes for a pregnancy, per some of the risk factors, you say that this woman has to deliver in a place where there's blood available, there's specialist care available, or an ICU available in case of any mishaps. So in that sense, you attend to the patient for about 6 months and then refer. So in that case, it's not an emergency. So when she goes, she's not going looking for a bed. She's going to be attended to, and then the referral center will plan her delivery. So it will be planned.
Hold on. So it means that you don't just refer someone within 2 or 3 days or a week when his or her situation is worse.
That is one core part of this issue, whereby if we improve on our health services in the local districts, then the need to refer reduces, and then also we can plan better. Because the only reason why I would refer a case to Korle Bu, which might need cesarean section, is because of the additional risk that I'm talking about, so that my ordinary cases that might need cesarean section will not end up on Korle Bu theater bed. So that is one aspect. Now, there's also the other element whereby we have hypertensive urgencies. I don't know the full details about these cases, but per my small experience, the stroke, when somebody gets a stroke, is untimely. Strokes are untimely. You need a neurologist, somebody that handles stroke, to see the patient early to intervene, as early as possible to intervene. So in that fashion, those cases, you need rapid response. So when it comes to my attention, right away I have to refer. And that one, we don't have control over that. Now, the bed issue is one issue that I'm not happy with. Okay, now this is how I look at it. Some might hate me for this, but I think that we need more specialists at the entry point. So when I refer, I always get upset when my letter ends up in excuse me. I love my nurses, but you'd refer a case and it ends up in a nurse's hand, and she will then even tell the patient, "Yenimpa." And that is where there's a problem. So that, because, a professor might refer and it will end up in somebody who doesn't even read the content of the referral and then just state that there's no bed, when in actuality it might be a case that needs to be from emergency straight to theater, not a matter of bed. Because if it's an appendix, it's not a matter of keeping the patient on the bed, and it's not. It doesn't come in. If it's let's say a maternal emergency, it's not a matter of
But does the bed really matter? Aren't there any other ways we could keep the patient and give the person first aid or that emergency treatment?
Well, the thing is, quality care has so many facets. I don't think I want to attend to patients on the floor. I don't think it's the right thing.
If the situation demands so.
But the thing is, we can't be in that situation for a long time. With this population we have now, we should have had like 3 more Kolebus. For instance, if there's a Kolebu in Kaswa, can you imagine how much relief it will be to the people in Kaswa, to have specialist care? And then, there are many times you have about 20 specialists sitting at Kolebu. I'm not saying they're not doing anything, but wouldn't we as a country be better served if our specialists are spread across so that they can then even develop more specialists at the various locations or handle a rotation? I can share with you countless times when you have like 10 doctors waiting and there's only 2 theaters to work on. I hope you understand.
That's the situation.
And that doesn't help us. So I think we should look into the idea of having satellite facilities with the kind of care that Kolebu provides, but satellite facilities, so that if you have a stroke, you don't necessarily have to be rushed to Kolebu, but then there's that same kind of modus of operation available midway, either Kaswa. If you're coming from Winneba to Kolebu and you can get the service you get at Kolebu at Kaswa, I think you'd have saved your life. And I think if we should move into that, whereby what can happen at 37 is replicated in various parts of the country or of the city, then we would have solved this problem.
All right, so before we end this interview, your general view on emergency response systems?
It's not enough. Now, I won't blame just the government. I think the entrepreneurs in the country, the businessmen, should look into it, because elsewhere the EMRS, which is the emergency response people, is a private business on its own. We cannot lay all our burdens on the government. I always say this. Microsoft came out of private individual, and it's helping many. Likewise, Apple. I hope you understand what I'm saying. So, as a country, let's not look just to government. There's a business opportunity in ambulance services. I think it's unfortunate that we are ready to pay more for the dead in an ambulance, but we're not ready to pay for the living in an ambulance. That's the country we live in.
So from the health professional point of view, emergency healthcare goes beyond just the bed. And as such, the death of a 70-year-old man, like in many other cases, could have been avoided. This has been another episode of News Connect on City TV. My name is Kojo Achman. Let's connect soon.